are doing. So with that said, I'm very excited to welcome our first guest, Dr. MJ. Would you please say something so we can pop you up on this screen?
Thank you so much, Laura, for having me. I really appreciate it.
Well, you're very welcome. I want to very quickly make sure that, oh, it's not letting me pin you to the top, and I would like to pin you, but it's not letting me. So we're just going to move on.
We just got to move on.
We're just going to move on. So Dr. MJ, I'm very excited to have you this evening. You're incredible in your field. So I'm just going to turn it over to you, introduce yourself, let them know your practice, and then what life looked like prior to being introduced to this wearable light technology that everyone's going to hear about, and where you've taken it to today.
Thank you so much, Laura. I really appreciate it. Hi, everyone. I'm Dr. Mary Jane Hanlon. I am from the New England area. I spent most of my time in Lexington, Massachusetts, but now live in Wolfboro, New Hampshire, where I do practice part-time as a general dentist. So I am kind of semi-retired. So I say that jokingly because I still work 3 days a week, but I don't own a practice. I don't want to own a practice anymore. Been there, done that. Don't want to do it again. So I spent about 20 years in private practice in Lexington, Mass, and then was recruited to go to Tufts University, where I was dean of clinics for 10 years. And so I got the academic bug, and I absolutely loved it. I love teaching. I love sharing my knowledge with my students. And then left there in 2021 to pursue an opportunity down in Knoxville, Tennessee, where I was supporting the dean of that school in starting a brand new school. And while I was down there, we decided that we were going to purchase practices for the students to go into to start getting experiences really early. One of the biggest challenges that I see in dental education is it really hasn't changed since the 1800s. So while there's a lot to learn, they still teach it the same old way, and there's so many other ways that we could be doing it better. So we started to buy practices down there, and that led me to being an owner of, I don't know, 8 to 10 practices by the time we were finished. And that was challenging. And I ended up being in business with a very narcissistic business partner, which I did not realize at the time. And unfortunately, got very sick. I ended up having to leave that business and come home. But before I did, I realized that my blood pressure was extremely high, dangerously high. And for those of you who understand blood pressure, mine was 230 over 132. So I was a stroke waiting to happen. And luckily, my husband was introduced to LifeWave probably 2 weeks earlier by our good friend, Nancy Cook. And as soon as I got to his house in Florida, he started patching me up. And in about 2 weeks, I had gotten it a little bit under control, but it took probably about 2 months, and it blew me away. I went to a follow-up appointment and my blood pressure was back to normal. So I know that stress causes a lot of things to happen in people's bodies. Obviously, that was my way of coping with the stress of, an unfortunate business situation. But my blood pressure was really high. And I am extremely thankful that I was introduced to the patches, because there was nothing else. They couldn't get me under control, even in the hospital with medication. So there's something more going on in my body than just the typical blood pressure issue. And I was very happy that I was introduced to the patches and that I recovered from that. Now, I believe totally that our bodies can heal themselves. I was told at 30 years old that I had a hypothyroid problem. I'm not a very good medicine taker. I never will be. So even to this day, I don't take the blood pressure medication that they've told me I have to take in order to live the rest of my life. I don't do it. That's my personal choice. I don't recommend that for anybody. But personally, I have found that my blood pressure stays under control. as long as I mediate my stress and I keep the patches on. So that was my first personal experience with the patches, and it was pretty significant. My second experience with the patches came probably back in July. And during that time, I had been away from home for 2 years and didn't really have a set exercise routine. And so I decided I had to get back into shape. And part of what I always did was eat healthy and exercise. And during that 2-year span of being down in Tennessee, I really just only walked and didn't have much of an exercise routine. So decided that I'd hire a coach and get back into shape again. And as many of you might know, the first time you do anything, just like flossing your teeth, your gums hurt when you floss for the first time. When you exercise and you're lifting weights, your muscles hurt. And so I was expecting this really horrible week coming up. And I just knew it was coming because, squats are really tough on the legs, and, any kind of time, when you first start lifting weights again, the muscles are sore. I had zero pain, zero. So I know it came from the X39, X49 that I was wearing in the Eon that I was wearing every single day. So 2 really significant experiences. Now I've been on the patches for 6 months now, and I'm in my 60s. So I'm starting to see some outward signs of improvement in my facial lines. So I'm really excited about that. So I can't say enough about the patches from my experience. Now, from a professional standpoint, if you've done any research on these patches, one of the things that they do is they create bone or help with bone regeneration. And with me, I'm very concerned about periodontal disease and the impact that these patches might have on people who do have periodontal disease. So I started tracking some patients that are patching and who do have periodontal disease, and I'm starting to see improvement. So I'm extremely excited about that for the dental profession, number one, because it will help us to eliminate dentistry is the only profession that wants to get rid of itself. We have fluoride for cavities. We're trying to get rid of cavities so that people and our generation, our children's generation, well, my child's generation, we have kids that didn't have cavities at all because we use sealants. So, I think that we are really prone to wanting to eliminate and prevent disease as much as possible. So this being a potential support to a good oral healthcare routine is extremely exciting to me. So for anybody out there that does have periodontal disease, please have them, and you decide to patch, please have them track your charting. And what I mean by that is they'll chart your pocketing levels, which anything from 0 to 3 is healthy. Anything 4 to 6 is the beginning of periodontal disease. And then anything over 6 is pretty substantial periodontal disease, and you might lose teeth. So if you have periodontal disease, it'd be worthwhile to try to patch and see what happens. So that's my experiences, Laura.
Wow.
And, I can't say enough about it.
I love that, and Dr. MJ. So let me ask you a couple questions.
Sure.
I love that you're talking about the bone growth, bone density, right?
Mm-hmm.
And you can only imagine what's going on in the rest of the body if it's working in your arena of care.
Sure.
And I love that, because do you find with patients that if they are experiencing this on a dental level, and I'm asking for education, do you find throughout the rest of their body that might be a concern as well?
So you mean
osteoporosis or things of that nature?
So I think the big key here is that the one thing that really people need to understand is any kind of bacteria in the mouth can get into the blood system and into our bodies and affect every organ that we have. And we're finding that more dis-ease in our bodies is caused by bacteria in our mouths. So if we're not keeping our gum tissue clean, if we're not brushing really well, and we're choosing not to do the things that we know that we should do every day, brush twice a day, floss once a day. I mean, it's pretty simple. It doesn't take that much time. That bacteria, if you're finding that your gums bleed during brushing, then that bacteria that's in your mouth is getting into your system. The number one reason that cardiovascular disease